Ask that each member of the public limit their comments to 3 minutes. We have a full house, so we'd like to let everyone have an opportunity to provide comment. So the board, a little background on the board for anyone, is a 7-member board. We're mostly an advisory board. We review institutional needs, oversight of operations, ultimately giving advice to the CEO. We also have control over a patient welfare fund, which we receive monthly reports on. That fund is used for activities and the welfare of patients. The board is constituted, was sworn in this year, March 15th, 2018. And since then, we've instituted a few new parameters. First, we have a very detailed presentation similar to what you'll see now on a monthly basis from the CEO. We were very keen after hearing from the public in our first meeting regarding census data, violence data, and hiring and firing mostly were very important to us. So as you'll see, the data points, they were implemented over the last year by us to make sure that we were kept up to date on a regular basis. We also created a health and safety committee. We're very fortunate to have Sheriff Gannon on the board and Michelle Brown, a former federal prosecutor. Sheriff Gannon is working hard to go over the policies and procedures regarding violence and safety. And he's working with local law enforcement, the Human Services, Police Department. Hopefully in the end, what we'll end up with is an independent audit and report that we can then implement new policies in the coming year. I want to thank you all for being here, and I'll turn it over to Ms. Tamika Carter, who has a PowerPoint presentation for everyone.
Good afternoon, everyone.
Good afternoon.
So, as you have just been introduced, this is our Greystone Park Psychiatric Hospital annual public meeting. So I wanted to bring to you today a discussion in regards to our leadership. What have our accomplishments been within this last year? So Greystone was able to fill 3 significant leadership vacancies in the latter part of 2017. And 1 significant vacancy, well now 2 in 2018 actually. September 2017, we had a deputy CEO where it's currently vacant, unfortunately, with acting DCEO, Eric Midurgi, which was my previous title. September 2017, we had the Director of Quality Management. November of 2017, we had the Medical Director come aboard. August of 2018, the Chief Nursing Officer was hired. And of August of 2018, Greystone received their CEO. The new leadership has enabled an increase in supervision, monitoring, accountability, support, and coaching for the clinical disciplines in the hospital. At this time, I would like to introduce the hospital's executive team. Tim Demetrius. Stand up, please. Stacy Provenzano, our Chief Operating Officer. Commissioner Deb Hartel, whose picture didn't get up there, but this is our Deputy Commissioner. Our Acting DCEO, Eric Midurgi. Our current Medical Director, Dr. Evaristo Accarelli. Our Quality Director, Dorothea Joseph Spaulding. Our current CNO, Dr. Laura Romano. Our 2 Directors of Nursing, Mr. David Hutchison. We have Lois. I was going to say Lois, yeah. Lois Seacrest. And we have our current Acting Human Resources Director, Mr. James Fry, known as Jim. And we did get pictures of our board. It's okay. Thank you, though. It's all right. So I wanted to talk about our current improvements. Our focus of the recent improvement efforts for the past year has been census reduction, clinical governance and quality of care, violence reduction, and workforce development. This slide actually will indicate our admissions and discharges since September of 2017, which is when I arrived, through November of 2018. The orange line indicates our discharges, and the blue line is our current admissions. So as you'll see that every single month we actually discharge more patients than we were actually admitting. In August of 2017, the census was at 548. In January 2018, the census decreased to 510. In July of 2018, the census further decreased to 476. Currently, our census of when I did this report was on December the 6th. Our census was at 441. Today, I'm happy to announce that our census is at 436. This represents a substantial decrease in our census since the beginning of the Murphy administration and a 20% decrease since the census reached its peak last summer. The census is down, as I said, today to 436. So the day of this report was 441. For the year, we have had 360 admissions. Discharges hospital-wide was 441. Our average length of stay on admissions for patients who were discharged, meaning that the patients were discharged back into the community, was 42 on our admission unit A1 and 38 days on B1. The average is 40 days. For those transferred to other units, it was 30 days on A1 and 29 days on B1, making the average 29.5. So this is just a graph that will actually show you about the actual data, quantitative data that I just provided you, indicating our census dropping. And another slide indicating you the same. And we like to see the slides that allow us to know that our census continues to reduce. So the census management, as far as the average patient census, again, from 2017 2018, as you see, that the orange line indicated where we were last year at 510 and today at 441, really 436. Active treatment. Improvement in our clinical and governance quality. The Program Oversight Committee, which is known as our POC, is a meeting that is held bi-weekly to ensure the quality and quantity programming is meeting the needs of our patients and the standard practice set by the hospital. A programming catalog, which we consider called the J-Wing catalog, allows a true conversation/engagement with the clinical team and the patient regarding their treatment and scheduled programming. This allows the patients to have a true participation in a selection of groups in which they are required to attend. This slide shows you all of the programming in which we actually provide. To name a few, we have academic education, addiction services, cognitive interventions, community reentry, coping and stress management, healing trauma, music therapy, physical activities, recreation, and leisure skills, with a slew of more. We are currently working on enhancing our DBT current program, which is in the works, and which we're working on system-wide, and thanks to the psychology department and the E2 team. The Wellness Committee. It's important for us here at Greystone to not only think about our patients, but to also think about our staff. So each Wednesday, we have an actual Wellness Wednesday. For the year of 2018 thus far, we have numerous events and activities. Social events, services, physical activities, music shows, presentations. Kudos to all at Greystone, and thank you, and hand clap to Rehab. Every week we send out all user emails, and these are what our flyers look out for every single event in which we actually have at the facility. Violence reduction. The medical director assumed responsibility of the Violence Prevention Committee. Under his leadership and in collaboration with the Director of Quality Management, each unit has incorporated violence prevention as a performance improvement initiative, which we are seeking reductions in assaults. Greystone's clinical staff has been educated on the use of the Brosette Violence Checklist, which is a tool used to assess patients for aggression. Greystone currently provides psychiatric emergency drills, which is facilitated by our training department. Thank you to our training department. The Special Instructions Service Unit, SISU, has begun August 1st of 2018, which is a group of staff members who specialize in using therapeutic communication and engagement to build relationships with staff and the patients. Kudos to the SISU team. Effectiveness of one-to-one meetings. The medical director implemented daily one-to-one meetings attended by the DCEO, nursing leadership, along with Greystone psychiatrists. This became effective January of 2018. Psychiatrists are responsible for presenting their patients who are on a one-to-one status while also addressing which patients are able to be removed from a one-to-one. If they are ineligible for removal for this status, the psychiatrist is required to provide a clinical rationale for the remaining of the status. Recommendations are provided by the medical director and often the deputy CEO to decrease the number of hours ordered on a one-to-one while concurrently ensuring safe periods for our patients, which is an example, a patient being placed on a one-to-one, remaining on a one-to-one while they are asleep. With this practice in place, Greystone has seen a 32% reduction in the number of one-to-one orders from January to June of 2018. This has liberated critical resources needed to meet the needs of higher acuity patients. And this is to show you the green being from 2017, the blue being 2018. Our average daily one-to-ones. We are usually averaged at 20.1. Our length of stay data, which are based off of discharges. So as you see, as the board has advised and requested, that we're able to break down our data from a 30-day, from a 1 to 3, to 3 to 5 years, for 5 to 10 years, and going forward. So it's important to note that some of our patients are under the criminal court supervision in which Greystone must await a court order in order to discharge them. So as you see on this data, for the year of less than 30 days, there have been 40 patients. 30 days to 1 year is 240. 365 days to 1,095, 93 patients. 1,095 to 1,825 days, 20 patients. 1,825 days to 3,650 days, 14. And 10 years and over, 6. The next few slides, you will see just the graphs of the depiction of the numbers indicated. So as you'll see, our patients are usually here just over a year. Just at a year, I should say, not over. So I'll stay less than 30 days. In the month of November was one discharge, but for the most part, we continue. Workforce development. Workforce development is how do we engage and be able to obtain and train our own staff in-house. For the month of 2018, we held many classes in which we did a total of 277 classes and served over 5,645 employees. Just to name a few, we have Oktoberfest, which is a mandated full-time week, nursing annual competencies, our psychiatric directives, and BLS, crossing the lines, defense driving, Fairleigh Dickinson leadership, HASCOM, HIPAA, new employee orientation, 3 steps to safety, therapeutic options day 1 and 2, psych emergency skills refresher, SISU orientation, active shooter training, transport special needs patients, supervision series classes. Oftentimes, our training department does just-in-time training. An incident may occur. They are sent out to the units to provide just-in-time training based on the current situation. Nursing competencies, they have also been high in demand for doing trainings in which they participate in the other trainings, but these are additional. 39 classes serving about 400 and 29 staff members. And as the board indicated, they are responsible for the welfare fund. For the year, these are the balances that are indicated for the welfare fund and what we actually use the funds for. Holiday celebrations for our patients, concerts that are provided. So as many of you know, they just had an entertainment literally right before this board meeting. Had us a little bit under pressure, but we got through it. Monthly birthday parties on our units. Every unit we conduct monthly birthday parties for the patients that are there. We provide them with luncheons, community trips, social activities, programming, shows, art workshops, movie trips, picnics, and the largest holiday coming is Christmas. And I thank you all for your time. I will now turn it over to Deb.
Good afternoon, everyone. As Jim said, I just wanted to make a brief announcement. Thank all of you for coming today. We have had a great opportunity of working with our partners in the governor's office as well as the Civil Service Commission, and I am pleased to announce that effective January of 2019, we are able to increase the 3-tier compensation levels for our psychiatrists. This is in furtherance of us being able to retain the psychiatrists that we have on staff across our entire hospital system, all 4 hospitals, as well as the special treatment unit in Avenel. It was important for us to maintain a sense of competition, right, with the private sector, and for us being able to bring on additional psychiatrists. There is a nationwide and statewide shortage of psychiatrists, and we needed to be competitive, and these new salary tiers will allow us to get much closer to what the private sector is able to offer. Also, the second announcement related to overall physician compensation and working with our partners at CWA, we negotiated a higher MOD rate, which again will help us to provide the necessary coverage after hours on weekends and holidays at all of our institutions. And so I just wanted to be able to bring that information. I know that it was a long time in coming, but it wasn't for not working on the very important topic. And certainly we are now looking at compression issues, as well as our nursing staff compensation, as well as we move into the new budget year. So I thank you.
We're going to start the public comment period now. We're just going to hop on the stage so we don't have our backs while we're in the front row. I received one slip with no name, so I don't know if anyone would like to. I got some more there. Anyone that's put in a slip first, you can go up to the mic and please provide your comments. And then anyone after that is free to come up. Anyone at all want to give a public comment? Okay, and I do have two written comments that I will have passed along to the executive team to ensure that they address these and look at them. With that, we'll close out the public comment period. Thank you all for coming. That'll end the public portion of the meeting. We appreciate everything, and thank you to the leadership team and management staff, and looking forward to a much better and even better 2019. Thank you all.
If only